Hello everyone, welcome to today's session. If you are new to our channel, please subscribe it for the daily videos. Hydatiform mole cyst. It is a non-cancerous tumor that develops in the uterus as a result of a non-viable pregnancy. There may or may not be an embryo or placental tissue present. If there is an embryo, it unfortunately won't be able to survive. Types: complete hydatiform mole. It is the placental tissue is abnormal swollen and appear to form fluid-filled cyst, and there is also no formation of fetal tissue. Fetus is absent, uterine size more than the date. Partial hydatiform mole may be normal placental tissue along with abnormally forming placental tissue. There also be formation of fetus, but the fetus is not able to survive. Fetus is present, uterine size less than the date. Signs and symptoms: dark brown to bright red vaginal bleeding during the first trimester. Sometimes dilation fluid also present due to rupture of cyst. Severe nausea and vomiting. Sometimes vaginal passage of grapes-like cyst. Pelvic pressure or pain. Other signs: rapid uterine growth, preeclampsia and anemia. Diagnosis test: history collection, physical examination, CBC, ABO, RH grouping, sonography, X-ray, histological examination, urine test, HCG value increase more than 1 lakh mlu per ml. Management: the first one is supportive management. Infusion, blood transfusion, antibiotics is given, blood is kept reserved. The second one is definitive management, suction evacuation. It is safe, rapid and effective in almost all the cases, and it is done even when the uterus is of 28-week gestation. Cervix favorable or a group A, mole is in process of expulsion. Cervix unfavorable or group B, the uterus remains inert. Surgical management include hysterectomy and curettage following vaginal evacuation. Thank you all. Have a nice day.